Many of you participated in a survey about TMJ disorder treatment. This was a survey that was done across all three networks. We invited the person who was a lead on this whole study, Eric Schifflin, who's at the University of Minnesota, to come and present some of these results because it's being presented at IADR in a couple of weeks. He was not able to, so we asked one of our faculty members at the University of Washington, Joana Cunha-Cruz, who has worked on this project and is one of the co-authors of the manuscript being put together, to give a brief overview of the results of this survey. Are you ready?
Okay, good morning. So I'm Joana and presenting the results for the Advancing Primary Care Management for TMJD pain. And I'm sure you all remember completing this survey back in 2009, 2010. It was a web survey, and it was done with all three networks. So I'll be presenting what are the symptoms most frequently reported by the patients, what you reported being the most frequently reported symptoms, what are the diagnostic methods being used, the treatments for temporomandibular joint disorder, including what you frequently use, what you prefer to use, and what would be like, what we want to study. Because the idea of this study was to see if we could do a randomized clinical trial, but based on what you would like to study, what were your interests. First, I'm going to be talking a little bit about the methods of the survey. It was a Condor study that involved both precedent in those regions here, Pearl in the purple, and DPBRN. So it involves all those states in the US, in addition to several countries in Sweden, Norway, and Denmark, and the Scandinavian. And it was a cross-sectional study. For eyes, it was web-based. For Pearl, I think it was web-based too. And then DPBRN had it on a paper. Data collection was done between August 2009 and August 2010. And it included both general dentists and specialty dentists. And the objective was to investigate TMJD diagnosis and treatments and the willingness to participate in a study. That was the main objective of the study. So what are the results? So 760 dentists participated, 190 from precedent, so it included the active members and also friends of precedent. The average age was 50 years old. About 20% were females, 20% were from race other than white, and the same amount practiced alone. Most of the dentists practiced for more than 20 years, and they told us that 35% saw more than 50 patients per week. 83% of the dentists referred to TMJD patients, on average of 3.6 patients per month, and 86% treated TMJD patients, on average of almost 9 patients per month. And 1 in 5 patients had severe pain. That's pain intensity between 7 and 10. The most frequently reported symptoms the patients had were jaw pain. The majority had jaw pain. This is the dentists are reporting what are the most commonly symptoms reported by their patients. So it's not the frequency of those symptoms that the patients have. Like it's not 76% of the patients have jaw pain. It's not that. It's 76% of the dentists reported that most of their patients had jaw pain. The same thing, half of the dentists reported that headache was a commonly reported symptoms by their patients. And facial pain and TMJ noise also were very common. And you can see that catching and locking of the jaw, it's around 22% of the dentists reported that. It's not a very common symptom for TMJD patients. As for the diagnosis, majority of the dentists were reporting asking specific questions for their patients and also doing clinical examinations. Among the specific questions, the 97% of the dentists asked the question, do you have pain in your temples, face, jaw joints, and jaw muscles? They are also asking other types of questions like pain on movements, like chewing, pain when clenching or grinding, and also when opening the mouth wide. What's interesting about this question here is that there are studies showing that if you just ask this question, you can have a good diagnosis of TMJD pain. The patients who answer yes for these first questions, they are more likely to have TMJD pain than if they have a yes for the other questions. So you can rely on this question alone to diagnose TMJD. Among the physical examination, palpation of the joints and palpation of the muscles were very common, and also examining for limited range of motion, TMJ noise, and the presence of pain when moving the jaw. So it seems that there is a throughout exam for diagnosed TMJ pain. What about the treatments? What are the treatments that you most likely to do the best initial treatments for TMJD? What do you think the dentists consider the best initial treatment for TMJ? Night guard? No, nothing? That's the best initial treatment for the patients? Okay, let's see what other dentists think about it. So for the best initial treatment, it's self-care. It's the most common one, with 70% of the dentists thinking that it's the best initial treatments. But they also think splints are very good too. 60% consider it also a good initial treatment. And we will go over it in a minute. It includes several exercises and avoiding biting the fingernails, avoiding stressful events that trigger the pain. We will go over it in a minute. And then over-the-counter medication is also high on the list. But then we also ask what were the most used treatments? What are the treatments that the dentists like the most? And what do you think it is? The splints? So, yes, by far, the most used one is splints mouth guard. So that's the treatment that the dentists like to use the most, followed by self-care and medications in general. It's like both over-the-counter and prescriptions. There's also some interest on occlusal adjustment and jaw exercise. Among the splints, it's the hard mouth guards that are the most commonly used by far also, way more than the soft cushion mouth guard and the other types of splints also that are not showing here. For the self-care, so here is the answer. What are the types of self-care most commonly used is advice to avoid clenching or grinding the teeth, avoid chewing gum, avoiding pain trigger events, and there is several instructions that are given to the patients to minimize TMJ pain. And for the medications, the most commonly used is ibuprofen, NSAIDs. And not only the over-the-counter, it's more common, but also prescription, and then naproxen also used, and a little bit less people using muscle relaxants also. So those are the most commonly used TMJD treatments done, I think we can say in the US, because we had like almost lots of dentists from several states. Then we asked them, would you like to participate in a study that will measure the efficacy of a treatment, the best initial treatment for TMJD patients? And 69% of the dentists said, yes, I would like to do it. And then we asked, why do you want to do it? The majority would like to generate good evidence. It's exciting. And then some would also like to give back to the profession, and a few think the monetary payment is also an important part of it. We also asked if in this study, would you be willing to assign your patients to different treatment groups? So the majority said yes, that they would do to different treatment groups, but not so many would assign a patient to receive a placebo or a no treatment group. So they are willing to participate, but they would prefer to do it with different treatments. So we can compare usual care with splints or with self-care. What is the study that you want to test? So we saw that what you consider the best initial treatment, then we saw what's most commonly used, but what are you interested in seeing tests in a randomized clinical trial? Do you have any guess? What do you think? Probably splints, right? And yes, it's splints. People are interested in looking at the efficacy of splints, but there is also some interest in self-care and jaw exercise. Why they think that it's interesting to look at splints? Because they think it's the best to reduce pain. This is interesting because there is evidence showing from long-term studies of up to 2 to 3 years showing that splints, if you do treatments with self-care, with good follow-up of the patients like you do with oral hygiene patients, that the staff can call the patient after to see how they are doing, to reinforce the instructions. The oral self-care works as good as the splints, and it's a cheaper alternative. So it's interesting to see that still the splints is seen as the best one to reduce pain. Self-care also has a lot of interest because of the cost. It's a low-cost intervention, and it's easy to apply. And jaw exercise also has some interest because of the cost and compliance of patients. But then we also ask, of those treatments, what are the barriers to implementing those in your practice? What do you think? Because on planning the study, we would like to overcome those barriers and see what we can do to best implement the study and the interventions. For the barriers for the dentist, on the side of the dentist, for the splints, is the cost, and because it's time-consuming to customize it to the patients. And for the other treatments, it seems that there is a concern with short-term efficacy for those treatments. But as I told you right now, there may be not true. There are some studies showing that there is some efficacy when done throughoutly, when we follow a protocol. So it's possible to do that too. For the jaw exercise, it was shown that there is some lack of experience or knowledge to apply that to the patients. On the side of the patients, it seems that splints, it's cost again, the most concern, the biggest concern, but also compliance. And for the rest of the treatments, compliance, patient compliance is a big issue too. They need to be doing some of those at home and on a daily basis. And for the prescription, there is also the concerns on side effects. But we saw that it's not most commonly used, the prescription medications. So I'd like to conclude and show you the frequency of the three things that we went over: the best initial treatment, the most used treatment, and what treatment to study. On that, we can see all together here that although self-care is considered the best initial treatment, it's not the most used one. It's the most used one are splints, and that's the one that people want to study. It's followed by self-care, and then there is some interest on jaw exercise. So dentists from the dental PBRNs, they want to participate in a randomized clinical trial on best initial treatment for TMJD to help generate better evidence. They are most interested in splints and self-care. They are more likely to assign patients to different treatments, and the barriers that they see, it's the cost and compliance for splints, and for the other treatments, efficacy and patient compliance also. I would like to thank you and emphasize that this was a Condor study done together with Precedent, Pearl Network, and DPBRN with the support of NIDCR. And if you have any questions, I would be glad to answer. It's, and this study was done jointly, like Tim said, with University of Minnesota, Eric Schiffman. And yes, there is a plans to do this study.
Is anybody looking at the fact that almost nobody thought it was the best initial treatment to do occlusal adjustments, yet 55% did? Is that?
Occlusal adjustment?
Yes, sorry. So in the best initial treatments, nobody thought it was good to do an occlusal adjustment, and yet 55% of the dentists did that for initial treatment.
Yeah, for that, I think the survey didn't include in the best initial treatments occlusal adjustments. Oh. Because it was based on the fact that there is evidence that occlusal adjustment is not the best initial treatments for TMJD pain. So this was the assumption. Although we can see that there is a lot of dentists, and I'm sure a lot of you are using occlusal adjustments, but it's not, the research done does not show that as a good treatment, initial treatment.
Thank you, Joana.